At Touro Dental Health, our infection control standards follow guidelines set forth by the Centers for Disease Control and Prevention. The following video presentation portrays the steps that need to be followed in setting up and breaking down a dental operatory. First setup of the day. Step 1. Wash your hands. Hand hygiene is the most important measure in preventing the spread of infection among patients and staff. A full 2-minute hand wash is the recommended allotted time by the CDC. Use soap and water and be sure to scrub, not rinse, your hands for the full 2 minutes. Step 2. Prepare the operatory. Inspect the operatory floor. Remove any debris and place in the appropriate container. Retrieve the water bottle from underneath the sink. Fill it up with water and attach it to the chair. Flip the master switch at the side of the handpiece console. This will power the chair and allow it to descend. Flush the water lines in the water and suction instruments console by plugging them into the wall unit and pressing the on button. Then set the timer for 1 minute. Step 3. Put on your personal protective equipment. Remove a face mask from the upper cabinet and put on protective eyewear, which can be safety glasses, goggles, or loupes with side shields. Remove a gown from the cabinet and put it on. Get gloves from the lower cabinet and put them on. Step 4. Spray, wipe, spray. Using the designated disinfectant spray, gently spray all flat cabinet surfaces, keyboards, mice, and trays, and wipe them down with sanitary wipes. You will find sanitary wipes in the cabinet. Next, respray and let surfaces dry for approximately 2 minutes. Do not spray the lenses or monitors. Take this time to wash your hands with the alcohol disinfectant, after which you should put on new, clean gloves. Step 5. Place barriers. Next, retrieve the barriers from the upper cabinets. Place the plastic bag barriers on the patient chair, patient headrest, doctor's tray, and assistant's work surface. Place the plastic adhesive squares on the assistant suction control, rear cabinet clock, both mice, doctor's handpiece controls, and the operating light handles. Place the tubing barriers and the disposable tip on the doctor's handpiece and the assistant's tubing. Step 6. Prepare the instruments. Set up the primary tray. This tray should hold a patient bib necklace, gauze, and instrument cassette. It is important that you do not open the instrument cassette until the patient is seated in the operatory. Set up the second tray with the instruments necessary for treatment. Resetting the operatory in between patients. Never walk out to the front while still wearing your PPEs. Step 1. Dispose or sterilize necessary materials. Inspect the operatory floor and remove any debris. In the event of a significant amount of blood or contaminated fluid on the floor, spray the fluid with disinfectant spray, cover it with sanitary wipe, and call facilities. All instruments must be collected and set aside for sterilization in the appropriate transport container. Barriers and any disposable items should be thrown away in the appropriate container. Any waste soiled with blood should be placed in the container designated for hazardous waste. Any needles, anesthetic carpools, disposable syringes, or endodontic files should be placed in the red bag container in the cabinet marked hazardous waste. Remove the gloves you used for cleanup and wash your hands again. Remember, hands should be washed before any breakdown or setup, when changing gloves, between seeing patients, and after bare-handed touching of any instruments or materials that may have come in contact with blood, saliva, or respiratory secretions. Step 2. Spray, wipe, spray. Using the designated disinfectant spray, gently spray all flat cabinet surfaces, keyboards, mice, and trays, and wipe them down with sanitary wipes. Do not spray the lenses or monitors. Next, respray and let surfaces dry for approximately 2 minutes. Take this time to wash your hands with the alcohol disinfectant, after which you should put on new clean gloves. Step 3. Place barriers. Next, retrieve the barriers from the upper cabinets. Place the plastic bag barriers on the patient chair, patient headrest, doctor's tray, and assistant's work surface. Place the plastic adhesive squares on the assistant's suction control, rear cabinet clock, both mice, doctor's handpiece controls, and operating light handles. Place the tubing barriers and the disposable tip on the doctor's handpiece and assistant's tubing. Step 4. Preparing the instruments. Set up the primary tray. This tray should hold a patient bib, bib necklace, gauze, and instrument cassette. Set up the secondary tray with the instruments necessary for treatment. End of day breakdown. To prepare the operatory for the next day, repeat the operatory reset as you would in between patients. Step 1. Return the operatory to its original condition. Raise the patient chair to its highest point before flipping the master switch at the back of the handpiece console. Inspect the operatory floor. If there is a significant amount of blood or contaminated fluid on the floor, spray the fluid with disinfectant spray, cover it with a sanitary wipe, and call facilities. Then remove the water bottle from the patient chair, empty it, and store it underneath the sink. Step 2. Turn machines off. Turn off all dental equipment and lights before leaving the operatory. It is important to follow these measures consistently so that we can maintain an infection-controlled, collaborative clinical environment and ensure the safety of our patients and staff. Thank you for doing your part at Touro Dental Health.